Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Whether you're suffering from a degenerative condition or a car accident injury, pain, tingling, and numbness caused by spinal stenosis can really have a debilitating effect on your life. It's likely that your doctor recommended a series of pain relievers, physical therapy, or even surgery to treat the condition, but is that really necessary? Can chiropractic help with a spinal stenosis injury? Well, let's take a deep dive into this and see if that's indeed the case. Spinal stenosis happens when the space within the spinal column is too small, and that puts pressure on the spinal cord and the surrounding nerves. Your spinal cord runs through the openings in the middle of your vertebrae with nerve roots branching out in between each vertebra. And if this opening is constricted in some way, it puts a lot of pressure on the spinal cord or the nerve roots, and that sends signals of pain and discomfort to other areas of the body. While this narrowing of the spinal cord can be caused by a variety of different conditions, spinal stenosis occurs most often in adults over the age of 50. Any part of your spine can be affected, but in most cases it originates in the cervical spine, which is your neck, or the lumbar spine, which is your low back. Most causes of spinal stenosis, most cases are caused by things like osteoarthritis. Here, wear and tear of your vertebrae rubbing against each other can lead to the growth of bone spurs, and as these bone spurs grow, they can put pressure on the surrounding nerves. Arthritis, though, isn't the only cause of this. Herniated discs, thickened ligaments, tumors, Paget's disease, spinal injuries, all these things can be to blame too. You can also be born with a similar, smaller spinal column, for example, than normal, and that puts pressure on the nerves as well. In short, basically anything that infringes on the space inside your vertebrae can lead to spinal stenosis and put pressure on the nerves. So what are some symptoms of spinal stenosis? Well, you can have back or neck pain, sciatica, balance problems, leg cramps too when standing or walking around, numbness, weakness, tingling, or even a loss of bladder and bowel control. So in order to pinpoint the source of your symptoms, typically x-rays will need to be taken, or you'll need an MRI or even CT scans to discover where the stenosis is coming from. So treatment options typically include pain relievers, physical therapy, steroid shots, and in most severe cases, surgery. But surgery is not necessary in many cases, and a lot of the other options I mentioned just act as chemical band-aids. They cover up the symptoms, don't really get to the root cause. So it's always better to get a second opinion, even a third opinion, if somebody recommends these things, especially surgery, because once you have that, you can never go back. And yes, chiropractic therapy can be incredibly beneficial for spinal stenosis, especially in the early stages. If the spinal canal is narrowed because of a herniated disc or a misaligned vertebrae, chiropractic adjustments can absolutely improve the symptoms at the source by alleviating pressure on the nerves and decreasing that irritation. Also, another type of chiropractic treatment is spinal flexion distraction therapy that can relieve pressure caused by compressed discs. Because chiropractic treatment has no side effects, it's often preferred as a natural, holistic way of addressing pain and discomfort. So you can get back to normal with chiropractic treatments. There's a good possibility that it can help, and you owe it to yourself to try. Check us out at newhopechiropractic.com, and you can even book an appointment through our website, and then get back on the road to better health and being out of pain. With that, have a healthy day.